Good evening. Thank you for coming out tonight in knowing that there's some weather on its way. What I'm going to do is I'm going to walk around a little bit. I don't like to stand behind a podium or whatever. And I also like to take questions during the presentation. So as you think of something, that's the best time to answer it. So feel free to raise your hand and I'll answer questions, because some of the stuff that we talk about is a little bit hard to explain and therefore hard to understand. And so answering your questions is sometimes easier than me just presenting it in our format. Okay? So one of the reasons we're here actually is as an opportunity to let people know that this resource that has been in Olmsted County for 50 years. So our anniversary was actually in 1966 to 2016, and so we're just here a little bit late. But a lot of people don't realize that the Rochester Epi Project has been going since 1966. So it's good information. So what I want to talk about tonight, I'd like to cover what a description of the Rochester Epi Project is, tell you a brief history, tell you what's in the future, but then the most fun is to show you what we've done using the Rochester Epi Project, some of the studies that we've done. So here is our website. If you go to our website, there are videos, a number of them. We have them in English, Spanish, and Somali. So if you'd like to view information after we're done for additional information, you're welcome to do that. So a description. The best place to start, especially when we're talking to people who are in Rochester and in Olmsted County, is to let you know that the description of the rep starts with where we're located. It started with any patient who is living in Olmsted County, Minnesota. And if you don't know yet, you will know by the end of this. The Rochester Epi Project is worldwide famous because of the research that's been able to be done using the rep in Olmsted County, Minnesota. So you will see publications that talk about the rep in countries outside of the U.S. and definitely nationwide. So the birth of this happened in 1966. You can see as far as the geography and the population has changed quite a bit from the inception of the rep. Somewhere between 65 and 70,000 people was the population of those that were in the rep. Now we're somewhere over 150,000 people in the rep. And our population isn't the number of people in Rochester necessarily, or people living in Olmsted County. It is patients living in Olmsted County who have visited one of the healthcare centers that are part of the rep, or one of our collaborators. So another way to describe the rep is who is a collaborator to form what is called the rep, because the rep on its own isn't really anything. The rep is made up of a collaboration of healthcare providers and the patients that go to those healthcare providers and then give their permission to use their medical records for research. That's what the rep is. So the participating care providers is Olmsted Medical Center and Mayo Clinic. It started with those two facilities back in 1966. And over the years, other facilities were added. Most recently is the health system. Olmsted County Public Health Services just a few years ago. Private practitioners, they came in from 1966 until the most recent was 2013. Dr. Banfield was our most recent private practitioner who participates in the rep. And then in the last few years, we started adding dental practices. And so we have 7 dental practices in Rochester that are participating in the rep. So what makes up the rep, once we have the geography, Olmsted County, Minnesota, we have the population, those are the people who go to those healthcare facilities in Olmsted County, Mayo Clinic, OMC, anyone who's participated as a collaborator. And then what we do that makes the rep unique is we have a records linkage system. And the reason that we're so good at it, and it is unique to the rep, is because we have been perfecting this since 1966. And obviously, as the technology has advanced, it's been much easier to advance how we link people so that we know that Jane Doe that went to the OMC in 1984 is the same that went to Mayo Clinic in 1996. So we have ways that we do that. And so we use the records at each of these providers and we link the person, and then we are able to see the lifetime of a patient in many cases. So if someone lives in Olmsted County their entire life, that is rich data for anyone who wants to do research, because they're able to follow someone for the lifetime. And you can understand that from the perspective of someone's studying cancer and they want to know, they have all these people that have lived there all their lives, and you could go back and you could see what are the factors that are the same for these people that came out with this outcome down the line. You'd be able to see whatever, kind of matched up. So being able to follow someone for their lifetime, and not only that, all of their records for the most part, is very unique, because we do just have the two main healthcare providers in Rochester. Yes?
So if someone moves outside of Olmsted County, is a part of the system?
Not necessarily. I'm going to show you that coming up. So that's actually a great question, because that's a big deal to us, is we need to know where people live. Good question. So here are some personal timelines, and it goes to your exact question, is we want to know where people live. So you can see how we have come up with a system that we need to be able to keep track. Is someone clearly living in Olmsted? We think they're living in Olmsted, it's yellow. We for sure know they're not living in Olmsted, it's red. We're pretty sure they're not living in Olmsted County, it's orange. And then if it's white, that's just flat out unknown. We are not sure. And so this is just an example of someone's timeline. And so in this case, if someone were doing a classic rep study, which is purely Olmsted County, anytime someone lived in the red, they would not be eligible to be part of a study. Yes?
But if they were still being by say, they could still be in other studies because they're...
But yes, absolutely. Yes, just not necessarily a rep study that the researcher pulled their names for who they're using in their research from the rep, but you could be called to any other study that, goes on at Mayo Clinic, because the reason you wouldn't be in a rep study, even though you would still be going to Mayo Clinic, is because it matters where you live, not where you go to the doctor in judging whether you're part of the rep. Because we had to come up with a system in the very beginning to say whether somebody was either in or they're out. It's an epidemiology thing.
all the way through with everything that happens for a lot of things.
Sure.
When they're not in Olmsted County, we lose a lot of data.
We do. What's a good example? When someone does a study and they come to us, generally they're coming in to do a study and they're looking at patients. They're looking at a very discrete time frame for the most part. They're looking at them from 2010 to 2015. So then they only look at people who are Olmsted County residents during that time frame. So it more has to do with the time frame that's set up by the study versus a study that was just following people that are, do you kind of see what I mean? What I'm trying to say is more the study sets up their parameters, which have to be really tight. So that's where the parameters come from. The way we set it up is so that it was easy for researchers to be able to say whether someone was in or out, using all of these different parameters, depending on, for us it's where they live, but it's the date, that they're using in a time frame. Sometimes they're just doing a 1-year time frame. Now I don't want to confuse anyone to think that all studies that are being done at Mayo Clinic, especially at Mayo Clinic, because if you doctor there and you have anything going on, you could be in multiple studies and they may not be related to the rep whatsoever. So it wouldn't matter where you live. You could live in Florida. You could live in Arizona. It wouldn't matter for Mayo Clinic studies. These are just rep studies that want to follow people through all of the care providers that they have visited within Olmsted County.
I don't understand why you limited it to Olmsted County. Is it just to limit the number of people?
In the very beginning, you mean? Yes. Yes. Yep, at the very beginning, and then it just kept growing, and then I'll show you that we've actually expanded from Olmsted County. So that's part of our future, is that it's not just Olmsted County anymore. So examples of timelines, you can tell, obviously the top one is very rich data for someone doing medical research, because they've got that person that they can follow for nearly that entire time versus someone that's coming in and out. Now, it's not to say that that person can't be followed during the time that they were in Olmsted County, because if the study includes those specific years, by all means they are in the study. It's just that when you can see that top timeline, that is definitely ideal. And there are many, many people who have lived in Olmsted County their entire life. So, again, this is just displaying why the rep data is so rich, because if you're able to follow someone from before they were even born, they're going to the doctor with their mom while she's pregnant, all the way through aging, there's a lot of stuff that happens with your health care, as you know, things that some people are healthy nearly their entire life, others it starts right away before they're even born. So there are so many things that have been studied, are being studied, and need to be studied. And so to be able to follow through those different times in our life is really important. So here are the different types of data. And this does capture almost all the types of data, and it gets more in detail beyond that. But in general, demographic data, we need to know where people live, and then we go by male, female, and age, and all of those things, because those are some of the parameters that researchers use in their studies as well. Medical diagnosis, surgical procedures, and so with medical diagnosis, it's both inpatient, outpatient, at all of the facilities as well, so both Mayo and OMC. It's in whether you stayed in the hospital or just came in for an appointment. Your prescriptions, laboratory tests, services and procedures, just the average go to the doctor type of thing when you're healthy, immunizations, and then life habits such as smoking, coffee drinking, things like that. Those are the two that primarily end up being a factor in the things that are being studied. Any questions on that? Yes?
Is there anything associated with Olmsted County itself, environmental tracking that goes along, temperature, air quality, all those other types of things, that add richness to location?
That is a great question, and yes, there is to some extent, as well as socioeconomic factors, a lot more difficult, and so we don't have that information, but a researcher could take the rep, use the rep, and then lay that over the information that they get from, the environmental information about Olmsted County or the socioeconomic. That's not necessarily put into our database, though, but that is a huge factor when they're trying to figure out why someone gets something. Exactly. Exactly.
Why do you, how do you do the life habits? Do you interview people when you come into the program?
No, we don't. That one is really tough to have consistently, because not all providers, clinics do it the same, nor have they done it the same over the years. Everyone's getting better. So that can be really spotty. Yeah. Yeah. Yeah, I filled out quite a few forms, at least recently anyway. Unfortunately, I go to the doctor a lot in the last year. But they have asked if you've ever smoked, how much you smoke, how much you drink, if you drink coffee, you don't drink coffee, what else? There's a lot. It's in detail. But they're not asking it, I shouldn't say, some are asking it, some aren't asking it, but then also some who are asking it aren't exactly using the same forms even at Mayo. And so that can kind of change the way our data is. So for instance, right now, smoking status is something new that we're finally able to put in consistently between Mayo and OMC. I shouldn't say consistently. We're able to put it in consistently. The data isn't necessarily consistent because we are blown away by the number of different forms and the different, because of the different forms, the different status that can be in just on something like smoking. Because sometimes all that's asked is whether you smoked or not. Another form says whether you smoked or not, did you ever, do you now, how many packs did you smoke, then, now, so there's all this detail, so it's hard to match up some of that. So our IT programmers have their hands full. That's what they're working on, to get as consistent as possible so that when researchers go to use it, they know what they can use. Any other questions before we go to history? Yes?
Just, Karen, it sounds like what you're really doing is developing this data that people can use in the future. Is that compared to the biobank, or is that a very different?
That's a great question. I actually want to add that to our presentation in the future because I get that question absolutely every single time. Ironically, most recently, the biobank is tied to the rep recently because we want to be able to use the information that they now have along with the rep. And what that means is just makes the rep data that much richer because of everything that the biobank asks for, plus they have the blood on hand. But the biobank is completely separate from the rep as a group. It's just that we have tried to partner most recently, and literally in a meeting this morning we talked about what do we need to do to run counts so that when our group, someone in our group, what she does is a researcher will give her the diagnosis codes for whatever it is they want to study. She'll run the counts to see, is that even feasible in Olmsted County? Because maybe we don't have enough of something in our area. So when she does that, in the future we want her to be able to pull biobank people in with that. So we want to be able to tell, are they in the rep, plus are they in the biobank? Because I think there's close to 50,000 in the biobank, definitely not all in Olmsted County, and I don't think all of them are necessarily in Minnesota, but there are definitely over 20,000 that are from Olmsted County that would help with the data that the rep has. So that's a great question. So your questions help us decide what we need to do in these presentations in the future so we can kind of anticipate those questions. But when you ask the question about the biobank, just for future reference, do you understand the biobank? Or is that something we could give a little bit of background on as well? What the biobank is?
I don't know if I understand it well enough. I understand it just rudimentally that they ask for my permission.
Yeah, yeah. Asked you to fill out a really big form.
Yes, yes. But I think of it as a way of contributing to science and allowing to be there. Whether it would be, because I'm in Olmsted County, it would reflect to your guys' stuff or not, I really don't know.
Yeah, that was a great connection. That was a great connection. So that does tell me, though, I would like to put a little bit of background about what the biobank is for the years. For myself, I can remember I joined in 2011 at Mayo. I think it was 2012 they came and asked me. I signed up, because I was like, oh, I'm new to research, and now, this is a great thing too. And now we've started wanting to partner with biobank, but beyond that, it's hard to describe it too in depth to you. So I just wonder what kind of questions we have. And even for myself, I had a personal question. I gave blood in 2012. I filled out the really big form, and in 2016 I came up with a serious health condition, and I've been curious, how long have I had this before I was diagnosed? I would love to be able to go back and look at that 2012 blood and find out, did I have it back then? Because they'd be able to run the same test. But we don't get to just have access to our blood. It's theirs now. I gave it to them. But those are the kind of things that I think would be really interesting to know. Okay, a little bit more history. Like I said, it started in 1966. It was started by Leonard Curlin. Dr. Curlin worked at Mayo Clinic, and he wrote a grant with this great idea. And the reason he had the idea in the first place was because of the outstanding records Mayo Clinic has. They're unique to anywhere in the world. Mayo Clinic literally has every single record going back to the beginning. Been to that building. They had to build a building to put all those paper records in that go back to the 1800s because they have kept that. Most places do not do that. OMC, in fact, does not do that. If we did not have a partnership and the rep didn't take their records and scan them to be part of the rep for those that say yes to research, their records would also be destroyed. So most healthcare organizations, they don't have the space. You know, Mayo had to literally build a building to put miles worth of records into. So most organizations wouldn't have that space. But I'm impressed by the foresight to what this means now. To those people who started saving the records in the first place, those people who put together records that would mean something so far down the road that when we go back and look at them, we have enough information to do research even still today. It's amazing, amazing people. Dr. Kurland is one of them. He still has relatives. His son works at OMC, and his son's daughter works with the rep. His son's wife works with the rep. So still part of the rep here. But he wrote a grant, he was funded, and the rest is history in a sense. But it started back in 1966 with, you know, very few people. And it was all because whoever was at Mayo at the time and whoever was at OMC at the time, again, had the foresight to go together and have a collaboration. When you think about it, when there's only, even in 2017, there's two healthcare providers, main healthcare providers in Rochester, for them to be willing to collaborate, back in 1966, very appreciative to those people that were willing to do that, because without that, we wouldn't have the rep or all the rich data that we now have. So, some pictures of the original paper archives, like I was telling you. The paper on the right, we still have that. There's still lots of paper floating around. We are in the process of scanning thousands and thousands of records, but yeah, it won't happen in my lifetime. There's so many records to be scanned, and I don't even know if there's enough money in my lifetime to pay for it. Scanning's expensive. It's nice to have records electronic, though. In this day and age, it's much more common for a researcher to want to be able to come in and do a study during years when all they have to do is run something on the computer. Because if you go too far back, you have to literally go look at the archives and look at the paper records to abstract the data, go to OMC to abstract the data. So it's a big deal, but we appreciate those that are willing to do the work. 1975 to 1995. 1975 is when the indexing first became computerized, and then they just kept improving the coding system, which now we're up to ICD-10 that was just implemented. And then in 95, Mayo transitioned to electronic medical record. OMC is behind that. They just finished complete transition to all electronic records about 3 years ago. And so it wasn't all at once. They did department by department, so they did it over years. But theirs was much more recent. So this is the tool that the rep uses for researchers. So it's too much to put on the screen, so it's too small for you to see. But what it is it's showing this patient, it's like Matthew Tester or whatever as an example, but you can see that they have records at all these different providers that may or may not be within the rep. Then it says whether they are yes or no to research. So what's really important to also know is that most researchers are doing chart review studies. So if they're doing it in the rep, they're not often sending off a survey or bringing you in. Not to say a rep study doesn't have that happen, but most rep studies are more just looking at your records, either electronically or the paper record. So what's important to know is whether someone has said yes or no to research. Minnesota is the only state that requires healthcare providers to ask their patients whether they are yes or no to research starting in 1997. And so you would have been given the opportunity, which is really hard to remember because you fill out a bunch of forms, so you may not even realize whether you signed it or not and if you said yes or no. But we only allow researchers to look at records that were a yes to research. If it's Right, yeah, because it's just a chart study. So as long as you've said yes, you might not even know. Yep. If you've said no and it's after 97, then you're not. If it's before 97, before we were required by Minnesota law to ask for research auth, your records could be used. Any other state, they don't ask. You're just, their records are used for studies. So Wisconsin, when I show you the expansion of the rep, is now part of the rep. Those patients don't get asked whether they want to be part of research or not, or whether their records can be reviewed. There is no state law there, so it's just the Minnesota patients. In 2009, which isn't that long ago when you think of that's how long it took for us to get a website, the rep. And we just changed it to look like this in the last couple of years, but it does have a lot of information on it now. We did improve it greatly in the last couple of years. So out there, like I said, are the videos. Also out there are all the publications that the rep has done. You can search by keywords and find a study. So what you're going to find is a paper. So it's something that was published in a journal, and it's scientific, so it's not, easy to read necessarily. But if you have a specific area that you're interested in, you could go there and look by topic for studies. 2009, some of our people in our rep group are happy that we made it to Wikipedia. So that's that. That's our old logo off to the right. So, important, the future. And it kind of goes back to the question about why Olmsted and whatnot. That's a great question, because that, at this point, does limit us to the number that can be part of the rep. Whereas if we try to expand within what we can afford with the grants that we're given, we can obviously have a lot more people in the rep, which means we can do studies on more rare conditions. So this is the expansion. We went to 27 counties. It looks really random as far as the 27 counties, but it's how it came out for numbers. We were trying to get to 500,000 patients. And so this was the most logical, based on where OMC has their branch clinics and where Mayo Clinic has their health system clinics. So it's a big deal to go from one Olmsted County to 27 counties. So we're still working on it. We've had a couple studies done using the 27 counties, but a lot more to come. Another thing that's coming out in the next few months actually is called the Data Exploration Portal, and it is a web-based tool that anyone can use. We've geared it obviously toward researchers and clinicians so that they can answer questions by going there. And so it can be used anywhere in the world. We're going to promote it everywhere in the U.S. anyway, but it will be based off of Olmsted County right now, and we may expand it to 27 counties. But it will be able to pull up, so if you want to see what the correlation is in Olmsted County between diabetes and kidney disease or Alzheimer's and diabetes or whatever it is, you can pull that up using this portal. We took it to our community advisory board meeting this fall, which is all community members, people that don't necessarily do research every day, and they were fascinated by it. As Walter was pulling things up, they're like, put these two things in. Let's see how this overlaps. Let's put these two things in. And it was because, what do I have? What are the two things I have, or the one thing I have, and I think I might have the other, or my family has, or whatever. And so that's why it's fascinating even just to the public. So we will be putting out a communication plan. We have like a 5-page communication plan to make sure that we can get that out to everybody, including the public. So for you guys, it would just be out of interest. But it is pretty interesting because it's real data. It's all aggregate behind the scenes, so you could never figure out what one person or one small group of people has, because we never want to be able to do that with our research. So you always have to have a certain number of people with a certain disease before we'll put it in there. But it is some good stuff. Yes?
When you expand now, are you
Oh, yeah, yep.
And you can track,
Yeah, so it's not all based on Olmsted anymore. It's based on the 27 counties. Either you're,
you can actually figure out where people moved within those 27 counties.
yeah, for the most part, yep, yep. Just based on where they've been going to the doctor, yep. Yeah, especially, the only way we're able to do that, obviously, is because we brought in the health system information because of all of the sites out there. So once we brought that in, we were able to say, hey, that person that we haven't had in the rep for the last 20 years or whatever has been over in Eau Claire. So now they are in the rep because they've been living there, and now the 27 counties is the rep. I should say, though, for now, most people are still doing Olmsted County studies. The 27 county is a little bit more complicated, but as time goes on, it'll get less complicated and we'll have more and more people using it. But the fact that it's possible is amazing when you go from 1 to 27. But go ahead.
They haven't been in there for years, could just mean they didn't go to the doctor for years, right?
Technically.
So is there a way that, like, that you can have people be able to get in there and update their own records and?
No.
Wouldn't that be helpful? If they
Oh, yeah, yeah, absolutely. We have other sources that we use with, we get birth records and death records from the state of Minnesota, just to be able to fill in some of our information. Over the years, we've done different things. Unfortunately, a lot of them cost money depending on what it is. Even the driver's license data we could get back in 2006 for a one-time shot was $5,000, which when you run off grants, unfortunately, that can get really expensive. So we keep trying to find different ways that we can keep up with that stuff. The easiest, though, is based on when people go to the doctor, because then they usually report what their address is, and so then we get an update. But yes?
So you're talking about adding these other counties and other providers to the program. What exactly does it entail, like, on a basic level, I guess, to add new groups?
What it really entails is behind the scenes. Technically, mostly the burden is on our IT programmers in that we had to get agreement from health system, but once health system really became incorporated with Mayo Clinic, and they are now considered Mayo Clinic and not Mayo Clinic in the health system, we needed that to have happened so that we had access to the databases where health system data is kept, and so then our IT programmers can have access to it. So that is probably the bulk of it, is those two things, the access to it and then our IT programmers being able to figure out how to do that and then make it, spit it out in our tool the way that we need it to. Same thing with public health. They don't have the same data fields as, for instance, Mayo Clinic or OMC, obviously, because they don't do the same things. So we've had to figure out how do we display public health, because there still are things that we want from public health, and it's a different group of population within Olmsted County that we want to be able to track for different studies as well. We have another group that has already signed, so it's okay to say that they're part of the rep. We just don't say it yet because the meeting's next Tuesday, but Zembro Valley Health Center has joined the rep, and we will be asking for research authorization from their clients going forward. And so it'll take a year before we get enough research authorization on enough people there, but then that will be included. And so there are a lot of mental health studies that need to be done that have not been done. And so having access to that data to anyone who says yes is going to be huge, huge. Any other questions yet? Okay. This is honestly the most fun part, is to see what kind of answers we've gotten by using the data within the rep. So one of the studies that's been done is that there was revised guidelines for breast cancer screenings, mammograms, put out in 2009. What it said is they recommend no routine screening for ages 40 to 49 and ages 75 and older. And so they did a study to find out, did what we put out from a rep study, how did that, get taken in by the providers? And so what we found is in the age groups of 40 to 49 and 50 to 74, the main two age groups that potentially would be having mammograms still, we didn't see a huge difference. Where we saw the difference was 75 plus. So it's kind of fascinating. It takes a long time though, because I asked the researcher who did this study, which anytime you do a study, you answer a question, but then it makes you ask another question, and so you'll see a few in here because I asked once we got I'm like, so what is that? Why? Why did that happen? They're like, well, we need to do another study to find out why it happened. So it's like, it's slow. It's a slow process, but same thing with changes being implemented from the time a research study happens to the time it actually affects patient care is a long time. There's probably been a study done for how many years it takes for something to be implemented. I just can't quote it right now. Time trends for dementia. In 1997, dementia had affected 2 million people. They say by 2047 that will go to 8 million. So the study was done to find out, is dementia increasing, decreasing, or stabilizing in America? What we found using the rep in Olmsted County, in all of the age groups, as you can see, it's going down. And they did publish a paper, and it got a lot of national press. Actually, all of Dr. Walter Roca, a lot of the studies are the ones I'm looking at here. He's gotten a lot of national press based on these studies, because this is one of them where I asked, oh, that's great, why? We got to do a study to find out why. So, it's one step at a time, but it's good news. It's just now, why is that happening? Risk and protective factors. The example here is men with prostate cancer are more likely to have fractures. So it's asked the question, the study, this is their hypothesis that they're trying to figure out is, does the type of therapy that treated their cancer increase or decrease their risk of fracture? And what they found is for those who used treatment that blocked testosterone, increased their risk of fracture significantly, more than double. Effectiveness of bilateral oophorectomy. This is another one that came out this past year and had a lot of press. So talks about 300,000 American women undergo preventative bilateral oophorectomy being both ovaries and fallopian tubes being removed. The frequency at the time of hysterectomy is increasing over time. So is oophorectomy a useful precautionary intervention? And what they found is prior to menopause, the effectiveness and the risk are not worth doing a bilateral oophorectomy. And so that's part of why the study hit the news as, what are you saying? Are you saying don't do a bilateral oophorectomy prior to menopause? And so those were some of the questions that came out of that. And in essence, that is what it's saying, is if you don't need to. Now this was talking about preventative, so I mean there are situations when you need to. It talks about certain genes, if you have those genes or if you have other risk factors, it still might be better to do it than to not do it. But in general, this was a big finding. The benefit is better post-menopause to do it than to not do it for preventative. Yep. Parkinson's disease. They're saying that by 2050, 1.8 million people with Parkinson's disease. So what they wanted to know was, if someone has Parkinson's disease, do they have a reduced survival rate, or will they continue to live just as long but with Parkinson's disease? And what they found is that someone with Parkinson's disease, they do have a lower survival rate. Now, of course, some of what goes into that is, when were you diagnosed with Parkinson's and how long is this, like most other diseases that you get. So it can depend on when that came in, but they did find that unfortunately there is a reduced life expectancy. So those are my studies, and go ahead.
Every once in a while, in the lay press, there's some study, there's some researcher somewhere
Oh, really?
Does that happen very often?
More what I have heard, I can't say for sure whether it's happened or not, more what I've heard in the time that I've been with the rep is that the rep is viewed as an expert in that area. So for instance, Dr. Walter Roca, he flies all over the world speaking. He spends almost half of his year flying somewhere, Abu Dhabi, he came back from Morocco, Italy, doing talks because the women's health, dementia and Parkinson's disease are his specialties, and he is world renowned. And so because he's connected to the rep, he is the principal investigator, one of the principal investigators of the rep. We're more looked to for, as an expert database for those type of studies. I can't say whether we've been used often to dispute some other study that was done somewhere else necessarily, though. But that would be a different population, so I suppose it would depend. Just one other example that is really cool that we have shared previously is the U.S. government used the REP data when they were determining how to make payment to people in the military who have had head trauma. So they use some of the studies that have been done in the REP, and it's in this really cool document that's really official. So that's been in the last 10 years or so. And there are a lot of head trauma studies. I don't know if you've seen those coming out of the REP as well. Dr. Rodolfo Savica, who has worked with Dr. Roca quite a bit. He's doing a lot of the head trauma studies. So he's trying to figure that out too, using Olmsted County as a database. Yes, sorry.
Every time you slow down, if that's your...
Yeah, sorry.
Are you still funded by NIH, or who funds you now?
We are, exactly. NIA is who funds us through National Institutes of Health. So National Institutes of Aging funded us most recently in 2015, and that grant goes through 2020. And we do get a little bit of money from Mayo Clinic, but they're constantly writing grants to keep us going. Yeah, so that's part of what plays into expanding to 27 counties. It takes a lot of money to do all this stuff, to pay programmers, to pay, to put all of this stuff in there and to keep it going, because every year you have to stay up with it. You have to stay up with it. We need to make sure that when a researcher is going to use our browser tool that I showed, that what they find in there is the correct data. So it's expensive, but they're really good at writing grants. I just hope they continue to be successful. I'm sure you all know that money has been really tight at NIH. And so there are a lot of groups actually at Mayo that have not been funded during some of the most recent rounds with their grants. So successful so far.
Like for researchers to use the database, or is it free?
Good question. There is not so far. Because we are funded by NIA, we have not been charging. Obviously, we've been discussing that, the less and less money that is available from NIA, creating a charge-out system. But at this point, we do not charge researchers. We haven't, but we did go to the development group at Mayo and said, can we be on the list so that when people come in who want to endow a bunch of money to someone at Mayo, that we are on that list. We're on the list. That's probably the most that we've been able to do, but yeah. Oh, yeah, we've thought of that. Thank you. That makes me feel better. Yeah. Other questions?
Since your project started out, you've had all kinds of new laws with FDA and with HIPAA and things like that. Has it had any effect on trying the confidentiality of material?
It hasn't, primarily because what we're dictated by is that Minnesota Research Auth. Either the patient has said yes to research or no to research, and most of our studies are just done using the chart record. It's the institution where the home of the chart, so Mayo or OMC, that's responsible for that part of it. So, and they're responsible for the research authorization. I should say that they're responsible for that as well, but that's the part that dictates to our researchers whether something can be used for research or not. But good question, yeah. So even like Zembro Valley Health Center, I say that they're part of the rep. They've signed all the legal documents as an organization, and we just don't publicize it yet because we haven't collected research off. When I say that, I actually mean they're collecting research off. That's their responsibility. We just do everything in our power to keep that as less of a burden on them as possible, because Zembro Valley Health Center right now isn't getting anything from us. There's nothing in it for them. OMC and Public Health, we've been able to write them into a grant where they get a small amount of money. It's not a lot, but it makes it a little more worthwhile versus Zembro Valley right now. We haven't been able to write them into a grant because they're new, so they're not getting anything. So we want to make sure that we keep the burden as low as possible. But at the end of the day, it's their responsibility. They're the ones who have to make sure that the forms are done the right way, HIPAA, all of that.
So you're not identified in the database by name, it's just, right? I mean, or is it?
In the rep browser tool, your name is in there because that's how we know who you are and that you're tied to all these records. But then when a study is done, it gets boiled down. They have programmers and statisticians who take that data, whoever was a yes, and whatever it is they do, and they have, their spreadsheets turns you into a number. You have a rep ID, basically.
But when they go in and look at it, they can see your name along with everything?
If they're looking at it in the browser, they can.
Because you said something about you can get surveyed, is that what you said? Like if they're studying something that you're doing, they'll bring it?
Yeah, not many rep studies will send out a survey to you. We've just had a few, ironically, but most studies where you're getting a survey at home or they're asking you to come in are probably just a Mayo Clinic study versus a rep study. And what makes it rep study is it has to be more than just Mayo Clinic. So throughout history, that meant it was Mayo and OMC patients were included. And most of them are that. But probably one of our most famous studies using the rep is the Mayo Clinic study of aging, Dr. Ron Peterson, who's at the White House, and he was working with President Obama, and the data he uses when they do that study, it is using the rep. And when we go to expos and things like that, between the biobank questions and the Mayo Clinic study of aging, those are the two most popular questions, because people have heard about that the most. So, sorry, I see you're waiting for me. Go ahead.
I'm just mindful that I'm trying to get you out of here before it snows. Right? So let's do the door prize and give Lisa a big round.
Yeah, thank you.
You can choose a name for the door prize.
Oh.
It's my fault. It's Barry. Yay!
He put in 5 of them, I saw. Thanks for coming tonight.
There you go. It's a shirt.